Hi everyone, Jennifer Blevin-Smith with Integral Clinic Solutions, and you're watching my YouTube channel, Navigating the Business of Medicine. Today we're going to talk about clean claims. You've probably heard the term before and you might even know what it means, but today we're just going to go over what clean claims means, how you get clean claims, why you want clean claims, and do a little bit of a recap. Let's talk about clean claims. What are they? This is kind of I don't know if it's a technical term, honestly, in healthcare, but if you work in healthcare, you use this term a lot, especially when you work in the revenue cycle side of it. And a clean claim is something that has the billing information on it, ICD codes, CPT codes, modifiers, everything like that, and it gets sent to the insurance without getting rejected and without having any denials. It means it's clean, it's accurate, it's good to go, and it gets processed as soon as it can, and you get paid for it, or you receive the adjudication saying it's okay to bill the patient for it, or a combination of both. And there's no extra work that goes into it. There's nothing that caused it to bounce back to you, to come back to you with some kind of denial or issue, and you can just put it to rest. This is your moneymaker, sending out clean claims. You want clean claims. You want clean claims because when you have clean claims, you have less time being worked and focused on that claim itself. If you think about each claim being worth the amount of money that's being charged on it, but keeping in mind that you're not going to get reimbursed that full amount, right? Because you have your contractual obligation write-offs. So you're going to get less already off the top of that charge amount because of the Code 45 contractual adjustment. And then you have to take into consideration everyone who has to touch that claim until it's paid. That's the staff that scrubs it, maybe a different staff member that has to submit it, another staff member that posts it, or it could all be the same staff, but it does take time, and time is money. The more you have to touch a claim, the more people who touch it because of their overheads and how much time, the less that claim becomes worth anything. It just keeps deducting what you're getting because instead of them being able to focus on more claims to get out, they're having to work on a claim that's already been submitted and having an issue. You want to make sure that you're getting the most bang for your buck. And by doing that is having very efficient processes, making sure that everyone is educated in their part of this revenue cycle, and ensuring that you're sending claims out that will not get rejected or denied. That you have a fast turnaround time at the insurance company. They go, oh, great, this looks wonderful, and they pay you immediately. Or, like I said, there could be a split responsibility between the insurance and the patient. Or, like right now, we're in deductible season, it could all go to patient responsibility. Even though you're not getting paid by the insurance for that, that fast turnaround time with that clean, no issue claim allows you to bill the patient faster, which statistically shows the sooner you bill a patient after their services are rendered, the better chance and more likely you are going to get paid quickly from the patient. All around, it's going to help your AR aging, it's going to help your claims be worth more money, and your staff is going to be able to get out more claims the more clean they are, and you'll get that money turned around a lot faster. You're probably asking, how do you send out clean claims? What really goes into making sure that you're sending out clean claims? And this is a great question. If you don't have a lot of background in revenue cycle, specifically in claims coding and claims billing, then this definitely is a good question for you. The how behind it is multifaceted, and honestly, it starts at the front desk or where the patient is scheduled. So if you have a designated scheduling team or group that does that, that is where it starts. A lot of times in electronic systems, patients are scheduled at the facility in which services are going to be rendered. That's the way it should be, right? Because that information is going to pull onto the claim data. At the facility, you have an associated place of service. It could be 11, it's a doctor's office. It could be 12 if it's a home situation. It could be 2 or 10 if it's telehealth, etc. And you have to make sure your staff understands how to schedule the patient correctly, because that's going to be one of the first pieces to this, is making sure that the right place of service is on the claim itself. They also need to be scheduled under a provider who is participating in network with that insurance, that they're affiliated with your group, that they're credentialed, that you take that insurance. That also starts at the front desk, making sure their eligibility is active with the insurance, making sure that benefits are covering the services that they're coming in for. All this starts at the front desk, and it has to be done correctly. Then the patient moves to the mid office where they see the providers and your other healthcare staff, like your medical assistants or your nurses. And everything needs to be captured on that encounter that is offered to the patient during services. So if the patient has an office visit, making sure that the right level of office visit is entered as the CPT code, making sure the correct diagnosis codes get affiliated with all of the CPT codes that will be listed. If there's more than one, that's great. If there's only one, that's okay too. Making sure you're capturing every service, as in injections, injection fees, like not just the medication, but the administration, right? Blood draws, any kind of point of care tests, everything like that. And making sure the right diagnosis codes are affiliated with each CPT code. It is very possible that not every ICD code on that encounter is going to be the first listed diagnosis code for each CPT code. For instance, maybe the patient came in E&M code for a drug recheck, right, with a follow-up for medications. However, they're not feeling well, and you decide to do maybe a strep test or a rapid flu. You would put the E&M code, most likely, I'm guessing, the primary diagnosis code would be whatever diagnosis they're on medications in which they needed that recheck. But for those point of care tests that you ran, you would put the symptoms in which they're experiencing at the time of service that prompted you to want to do those tests. So that means that the number one diagnosis affiliated with the E&M code is going to be different than the diagnosis affiliated with those point of care tests. This is a perfect example of not having someone scrub those appropriately to catch this, and the claim going out and it not getting paid because you don't have correct links between diagnosis and CPT codes. Okay, so even if your back office medical staff is entering CPT codes and diagnosis codes, you still need somebody, in my recommendation and best practice, who has a knowledge base for coding to come in and scrub this and make sure it's all lined up. Also, was a modifier 25 added to it, because an E&M code, if you bill out those point of care tests with it without an appropriate modifier, it could get denied, saying that it's bundled or the payment is included with that E&M code. And you don't want that, because it was separate and identifiable reasons that you did these different services. And if that's not something that your staff is well versed in or easy to forget, that's another way that you could get a denial or rejection at the insurance company. The next thing is making sure that you have appropriate charges affiliated to these, and making sure if you need a referral or authorization that that's on a claim and that's included. There's so many different things, and I could go on and on and on and how to make sure that you have a clean claim, but these are some of the really major common ways that I see rejections and denials come through because it's missing or used incorrectly or not done correctly. You should have a what we call a first time pass rate of 95% or higher on your claims. So if you took the total amount of claims you submitted during a certain time frame and you divided it by the number of claims that either got rejected and or denied or had an issue on the claim when it got returned from the insurance, your percentage should be less than 5% of rejections or denials in that total amount of claims submitted. If you're higher than that, something's not right. You need to go back upstream and you need to find out what's going on that's preventing you from being able to send clean claims. Just remember, sending out dirty claims is going to cost you more money. The worth of each claim is going to be worth less, and it's going to be very hard to make up that money quickly. It's kind of like one of those things where if you get a bad grade or a bad credit on your a ding on your credit and your credit score drops, it drops so fast and it takes forever to get it back high up again, just like a GPA, right? You get a GPA, a good GPA, it's really good. You get one bad grade and then it's like, ugh, and you have to work really, really hard to get it back up. It's the same thing with sending out clean claims and getting a good revenue flow, and then sending out dirty claims and having all of these issues and trying to backtrack and refill and get caught up on that revenue. The financial hit on this can be detrimental to some practices, especially if these unclean or dirty claims is the majority of what you're sending out, or it's very consistent to be a high percentage and nobody's working them fast enough. You risk timely filing, you risk a lot of things. And we can talk about that in another video. However, you want things to start well. You want it to start on the good foot. And I am a very big proponent of being proactive and not reactive. So the more dirty or unclean claims that you can figure out the underlying reason of what's causing it to fix it upstream to prevent it from happening again and again will only benefit you. It will benefit your staff, it will benefit your patients, and it will benefit the bottom line, which is your finances. If you have any questions or comments about this, please leave that in the comments below. Smash the thumbs up button if today's video was helpful. Subscribe to my channel if you haven't already, and please share this with your colleagues whom you feel would benefit. I appreciate your time today. Take care. Bye-bye.